Hello friends, welcome back to my channel. Today I am going to discuss with you regarding a role play card. Okay, that is a speaking OET part. And in this, the setting is community health center and background history is nurse, that is you see a 40 years old patient who had large carbuncle, that is a pus formation filled with the infection on his neck surgically drained under sedation. You have just packed and dressed the wound and now advising the patient on the next step. So this is a background history, means patient is 40 years and patient have problem, that is carbuncle, and here the patient is just packed and came for just packed and dressed the wound. That means the case is known. So our speaking is the known case. So in this case, the nurse mainly finished the dressing of the wound and gave some instruction to the patient. So there is no need for any introduction because dressing is done. Then we can start this speaking like this. Thank you for your cooperation for packing and dressing your carbuncle. May I know how are you feeling right now? So like this we can start our conversation based on that task. That is, first task is confirm the completion of wound care and find out how the patient is feeling. So we can start like this. Thank you for your cooperation for packing and dressing your carbuncle. And then another sentence is find out how the patient is feeling, and we can say like this, may I know how are you feeling right now? Okay, so next task is explain next step, that is arranging pain relief, keeping packing on, repacking, top dressing on the alternative days. Outline need to keep the packing on until next follow-up appointment in 3 days. So second task is this, and before that patient asks like this, oh little sore is my neck, in my neck. So when we ask the patient that how he or she is feeling, we can say then the patient will reply us, oh little sore in my neck. So as a nurse we can reply to the patient, well Mr. James, I am sorry to hear that, but try not to worry. I can arrange you some painkiller medication along with that. Okay, like this. Next step is the for arranging the pain relief. So we can construct the sentence like this. I can arrange you some pain relief medication along with that, means we can combine the next point and use this connector along with that. Then I would like to let you know few measures, that is repacking is also necessary on alternative days. Another sentence is there, so we can also connecting that sentence with the previous sentence. We can again use a connector, that is in addition. It is important that you keep your packing on until your next follow-up appointment, while will be in the 3 days. Okay, so like this we can construct the whole sentence for the task second. Next is the task third. Stress the importance of hand hygiene during dressing changes, that is in bracket for prevention of infection. So we can construct this sentence like this. Apart from that, the hand hygiene is extremely important when you do the dressing changes, so that it prevents infection. Are you getting my point, Mr. James? So like this we can construct the sentence. Okay, next the patient will reply us, yes I would do this, or I would be able to do like this. Okay, so then next the patient has query, because so like the fourth task, patient is having interference with the wound. So as a nurse we can start this sentence like this, sorry Mr. John, sorry, Mr. James, I can sense your anxiousness. However, it is not advisable to remove the dressing because it can worsen the situation. So, we can tell the patient regarding the why we are not removing the dressing. Okay, and after that we can also tell the patient, let me explain to you that in detail, because please make sure to avoid unnecessary interference with the wound, otherwise it may damage the packaging or may lead to secondary infection. Okay, so this is the main point. Okay, so next is the fifth task, give detail of follow-up appointment, bandage removal, wound examination and self-care advices. So for this we can say that moreover it prevents the faster healing of the wound. I would also like to let you know that you need to take care for and came for the follow-up appointment in order to remove that bandage and wound examination. Are you able to understand? Okay, so like this we can ask from the patient. Okay, and the next task is reassure about healing of wound. Here we can assure the patient, because patient is having the anxious regarding the healing of the wound. So the patient is having a concern regarding the infection of the wound. So we can answer the patient like this, your worries are reasonable, because patient is in worry. So we can use this phrase, your worries are responsible, Mr. James. I can assure you that you will certainly get a better recovery sooner with no risk of infection, because we can use these bracket points: low risk of infection, 7-day course of antibiotics, prophylactic use, begin immediately. So like this we can construct all the points in a sentence. So after that we can say, if you follow all the instructions and medication properly, a course of antibiotics for several days. Along with that, you need to start prophylactics immediately, which will prevent numerous infection. Okay, so we can tell the patient these all points in a proper way. Okay, next is the seventh task, that is explain when to see the doctor. So we can they are giving us the point like increased pain, feeling unwell, fever, leakage of pus or blood, etc. So we can say it is imperative to meet your doctor in case of increased pain or you are feeling unwell, even when you have a fever. Along with this, any leakage of pus or blood you have noticed, so meet your doctor immediately. So like this we can say to the patient. Next is the eighth point, that is find out patient transport home arrangement. So here's find out, we can check from the patient that patient is having any arrangement at home for transport or not. So we can construct the question like this: Mr. James, could you please tell me regarding the home arrangement for the transportation you have or not? So then the patient will reply us that there is no any arrangement. So as a nurse we can stress the patient, like next task is stress importance of not driving, that is restriction of neck movement after effect of the sedation not covered by insurance, etc. So for this we can construct a sentence like this: Mr. James, I understand your situation, but I would not recommend you to drive in your situation because of your neck movement and often effects of the sedation. Moreover, it does not come under the insurance protection. Instead, you start alternative transport arrangement. Is that okay? So we can ask from the patient, then patient will reply us that he or she can able to do this. So as a nurse we can say, I am happy to know that. Okay, so after then we can reply to the patient. And at last, advice need for alternative transport arrangement. So we can also tell the patient that it is very important for you to arrange an alternative transport arrangement so that your complications can be reduced. So at last we can ask from the patient that, do you have any more question to ask? So if the patient say that, sister, well, you have cleared all my doubts, then we can reply to the patient, okay, thank you, Mr. James. I wish you for your speedy recovery. Thank you.